Hello, and thank you for tuning in to our live Q&A where we'll be answering your questions and concerns about COVID-19. Today, I'm joined by Dr. Theresa Brennan, Chief Medical Officer at University of Iowa Hospitals and Clinics. Please submit any questions or concerns you have for Dr. Brennan, and we'll answer as many of them as we can. Thanks for joining us today, Dr. Brennan.
Sure, happy to be here.
So could you please give us a brief overview of how the number of COVID-19 cases and hospitalizations are changing here in Johnson County and across the state?
Yeah, so it's really important that everybody understands what's happening. The number of cases in the state has gone up, and it's really been more localized in certain counties, but over the last few days is becoming more broadly disseminated. So lots of counties are increasing their numbers of cases. The number of cases in Johnson County has really increased remarkably. And clearly we are in the presence of an outbreak. The number of hospitalizations for us and for pretty much any individual hospital may not have increased too remarkably. They're probably up a little bit from the midsummer when things were a little quieter. But when we look at different regions, so COVID response has been divided into, the state has been divided into different regions. We're in region 5. And when we look at the hospitalizations in that region, the hospitalizations have increased since about the end of June, early July. So there is some increase, but we individually have not seen a market increase.
So as an average person out in the community, is one of those two numbers, the cases versus the hospitalizations, a more important number to focus on?
Yeah, there's lots of things that we focus on with respect to COVID-19 and the numbers. Important that we recognize what each individual number means. So we talk about the number of cases per 100,000 people in a state or in a county. We're a pretty small state. So when we have a large number of cases, then it will clearly show that we have a larger number of cases per 100,000 people. And because of that, Iowa's been in the news, right? Because our numbers have increased. We also look at positivity rate. And both of these are impacted by the amount of testing you do. So particularly here in Johnson County, we do a lot of testing. We do a lot of testing because it's the right thing to do. And it's important to identify who has COVID-19 and who doesn't. When we look at the positivity rate over the last probably couple of weeks, that rate has gone up significantly. At one point in time, we were almost to 50%. And what that number means is that when someone who has symptoms comes in and gets tested, about half of those symptomatic people will have a positive test on that day. So that's a lot. That number has decreased about half now. We're kind of in the low to mid 20s for our institution. So for the people who are coming to get tested with us. And again, that number is based on symptomatic individuals. So it's not people that have no symptoms of COVID that are being tested because they've been exposed or because they're having a procedure, for example. We also look at the rate of infection and how that's changing. And we also look at the number of people that are being infected when an individual gets infected. So that spread factor. So all of those numbers are important. I think some may be more important to you as an individual. So as a healthcare provider, it's really important for me to see hospitalization rates because that increases the potential for our employees to be impacted and increases the resources that we need to have available to patients so that we can take care of patients when they need to be hospitalized. I think one of the important numbers for a community member is what is the prevalence in the community? What are the number of cases per 100,000? What is the rate of infection? What's that positivity rate? Those are things that I think are important because it gives us a good idea of how prevalent it is in the community that we live in and how careful we have to be. I think now people that live in Johnson County are much more careful this week than they were perhaps a few weeks ago. And that's pretty normal. It's been a long time. COVID has been with us a long time and we're all tired. And, with that fatigue comes some complacency and people, maybe don't wear their mask when they're out in the community because it's only going to be for a short time or they feel like they're going to be safe. And I would say that if you live in Iowa or many other states, actually, or if you live in a county in Johnson County, where the rates are very high, that you have to be very vigilant about those safety precautions.
And I know, as you said, we're all tired and it seems like we've heard these things over and over and over again, but would you mind taking a moment to just review the 3 W's for us and why those are so important to do?
Sure. Yeah, it seems really simplistic, right? And, I think that there's been a lot of focus on what we should do as a society and the decisions that perhaps leaders are making. And I guess I just want to take a moment to say that we each have the potential to have some influence, more or less, on perhaps what those decisions are. But what we each own is what we do ourselves. And I think, when we talk about, are we doing enough, or should we be doing more, or what should we be doing? For me, it starts at home. It starts with me and what I'm doing. And those 3 W's we talked about before COVID ever got to Iowa, and we've continued to talk about it since. Watch your distance, wash your hands, wear your mask. If we continue to use those 3, and the order, I don't think we know what the most important one is. But maybe we know that distance and wearing your mask are probably at least as important, if not maybe a little more than washing your hands. That's not to say to stop washing your hands, but really important that we watch those 2, and they work together, right? So if you do both of them, you're going to be far more protected than if you do one or the other.
Great. Thank you for reviewing those. And that leads us into our next question, which is, it's an opinion question. In your opinion, do you feel like we're doing enough right now to prevent the spread?
Yeah, I mean, the logical scientific person in me says no, right? Because it's spreading. So, I think each of us individually can go back to what can we do individually? How can we influence others? John F. Kennedy said, "It's not what my country can do for me; it's what I can do for my country." And I think that's, it sounds very cliche, but it's really important. When we wear our mask and when we distance, we protect ourselves, but we protect others as well. And so, thinking about the people that are around you and trying to do what you can individually, like I said, take ownership and empower yourself to do the things that you can do, that no one can take away that from you. You can wear your mask, or you can not wear your mask, and that's your own personal decision. So we should each own that, and we'll see how things go. But we do know that when we did this in March, right, when we distanced by really shutting down things, and we wore our masks when we had to go out, that we were able to get those volumes down, and Iowa actually did really well. Johnson County did really well. If you remember, we had the first cases in Iowa, and there was a great deal of concern that it was going to really create a local outbreak, and we all did a great job at not letting that happen. I think we can do it again.
Yeah, it's that we're in this together or we stand together motto. I mean, I know we're 6 months into this almost, but that still stands. We have to all do our part, and we can get through this, but we're all each going to have to, like you said, take the responsibility to do what we can.
Yes.
So
the last thing I'll say, and I probably should have said this already, but I think it's really important, and it probably seems very logical, but if you have symptoms, seek medical care. And if you've been exposed, a high-risk exposure, you certainly want to quarantine. If you're an essential worker, you may have to go to work, but otherwise you should be quarantined. So make sure that you're doing that if you fall into one of those groups.
And we're still encouraging people to reach out to their healthcare provider before just showing up at a hospital, correct? Just to avoid potential spread?
Yeah, and to make sure that they're ready for you. And to not put others at risk. Yes.
Great. So guidance came out last week from the CDC about COVID-19 testing, and it caused a little bit of confusion. Can you clarify what our process at the hospital is for COVID-19 testing?
Sure. So that's evolved, as with everything, COVID. Things have changed. But for the last many, many weeks, we are testing everyone who's symptomatic. So if you have symptoms, you will be tested. And for us, we do that through going through a path of a televisit and then ultimately through our ILI clinic for that testing to be done. So testing symptomatic people, the CDC recommendations are kind of a minimal recommendation. They're the base recommendations. We're going beyond that and testing everyone. The second is if you've been exposed, so a high risk exposure, and you're asymptomatic, we are testing people at about 10 days. We know from the data that we've seen with these patients who have been exposed and then ultimately convert, meaning they become positive, they have COVID-19, so they have a high risk exposure and then they develop the disease, that the vast majority of patients will become positive within 10 days.
Great. So if you're just joining us, we are here with Dr. Theresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, and we're answering all your questions about COVID-19. So please leave any of your questions and concerns in the comments below, and we'll get to as many of them as we can throughout our discussion. Dr. Brennan, let's get to some of the questions that are being submitted on Facebook Live. Denise asks, how can we explain to others that masks are important? I think that's a common concern for people, is how do you explain to loved ones or friends or even people you just see out of why we should be still doing this?
Yeah, we have this conversation in my household, actually. How do I explain this to people? So the first thing I would say is that there is data, many studies. A few weeks ago, I think that number was 70. It's probably twice that now, that show that wearing a mask versus not wearing a mask actually is protective. And so, if nothing else, go to the science. That the scientific analysis has shown that wearing masks prevents the spread of COVID-19. I think the other thing that's really important to recognize with respect to masks is that, if you're sick, you're probably not out interacting with people. The likelihood is that you're home trying to recover. But if you have COVID-19 and you're asymptomatic, meaning you have no symptoms, you don't know unless you've been tested. And if you don't know, then the only way to universally protect is to wear the face mask. And so people could spread it, and we know that this happens when they're not symptomatic. And so wearing that mask, even if you feel fine, is really important. I actually also talk about the fact that, you wear your mask to help others, right? You don't know the people that you come in contact with, what their risk status is. And I think we would all feel terrible to give COVID-19 to someone who has a bad outcome. And so, if the science doesn't help, I would really go to people's humanity, that, we do this because we are all in this together. And no matter what, we're all going to get through this together. And we have to do what we can to make sure that we all get through it successfully.
Yeah, I've heard this analogy a lot, that it's like your seatbelt in your car. You trust that you're going to drive safely and that you aren't going to get in a car accident, but you can't guarantee that. And that's why you wear a seatbelt in your car. And that's why others wear seatbelts while they're driving or riding in a car. And so it's a similar in that way. If you can understand why it's important to wear your seatbelt, the same kind of idea translates to face masks.
Agreed.
So you talked about asymptomatic patients, and that leads perfectly into the next question. Tony asks, if someone is asymptomatic, how will they know they need to quarantine? What if they have some symptoms, but not a very severe symptom?
Yeah, so if you have symptoms, you should definitely talk to a healthcare provider. We know a lot more about the symptoms of COVID-19 than we did at the start, but any sort of respiratory symptoms, loss of smell, even some symptoms from your GI tract like diarrhea and belly pain could signify COVID-19. So if you have it and it goes away in one day, maybe it's not, but it's always a good idea to have a conversation with a healthcare provider, which could result in you being tested. If we talk about people that have no symptoms, the likelihood of you being infected is directly related to you being exposed, right? So if you've been in your home and you have no exposures, the likelihood of getting infected is very, very, very low. But if you're out in the community, particularly if you were interacting with someone without wearing your mask. So let me just step back and talk about high-risk exposure. So high-risk exposure is defined by being within 6 feet of someone who has COVID-19 for at least 15 minutes and not having face protection. So not having protection on one or both of the people. So if you are in a high-risk exposure, then you would likely have been contacted by someone from public health. And you would then be recommended to quarantine, meaning you stay in your home for 14 days, and that at 10 to 12 days that you consider having a test. Again, that's our practice. It's a little bit different from the CDC's recommendation in that it's a little more aggressive. But for sure, if you're in a high-risk population, you are a healthcare worker, you work in a long-term care facility, or you live with someone who's a high-risk person, we would want you to be tested. So that's how you would know. First, having had an exposure, and second, having had a contact by Johnson County Public Health, the Department of Health in your area, et cetera. So with COVID being so prevalent in the community, with the numbers going up so remarkably, there may be people that don't recognize that they've had an exposure. And that's where the concern about being asymptomatic and potentially spreading it, and even if you haven't had an exposure, you need to wear your mask, right? So we rely on those exposures to help us to know who should be quarantined and who should be tested. But we should all consider ourselves to potentially have an asymptomatic state and really take that mask precaution.
Linda asks, should you wear a mask outside walking or biking, or even when you're in your own yard, especially, if there's a chance that neighbors would be walking by? Do you recommend people wear their masks outdoors?
So I recommend that you have your mask with you. It's the weather has been intermittently lovely, and important that we get out and enjoy it after, a long, hard COVID isolation, right? So important that we're able to get out and potentially breathe the fresh air. The importance of the mask really is when you're coming in contact with people. So if you're in your yard doing some gardening and no one's around you, then you don't need to have your mask. But if the neighbor, for example, comes over and you're going to be within a 6 feet distance, it's of course better to be outside when you're interacting with people, but still in that situation would have a mask available. If you're running, you can probably, keep yourself away from people, and hopefully you wouldn't have to wear a mask. I have seen people run with masks on, and my heart goes out to them because I can't even imagine exercising with a mask on, but you have to balance the risk and benefit.
Yeah, absolutely. And so Amanda asks, how does this type of outbreak compare to a bad flu season? And are hospitalizations and deaths comparable to a bad flu season?
Yeah, I mean, internationally and nationally, the numbers are far greater than a bad flu season, both from the number of cases we see to the number of hospitalizations we have and to the number of deaths we've seen. And there's a lot of debate about what is a COVID-19 death. And I know that there was some data published recently about, a small percentage of people have COVID-19 and die and don't have any other comorbidities. But the reality is that a lot of the population has those comorbidities, and their death is related to COVID-19. It may be exacerbated or maybe worsened. Their likelihood of dying or doing poorly might be worsened by those comorbidities, but the reality is that they still died of COVID-19. The data, as with any data, it's only as good as what's put in. And, you can choose to trust or not trust. But if you think about data not being correct, generally, it may be incorrect by, 10% or 20%. It's not going to be incorrect by 90%. So I believe the data for the most part. And I believe that the number of hospitalizations, that the prevalence has gone up, and that the number of deaths has gone up. I can see here we have had more COVID-19 hospitalizations than we've had influenza hospitalizations in my time here at the University of Iowa. So I certainly see it locally that the number of hospitalizations is clearly worse than any influenza season we've seen.
Yeah, and aside from the numbers, the two viruses are not the same. There's differences between, yes, the flu can make you very sick and hospitalize you, but COVID has some long-term consequences that we're still learning about, right?
Yes.
Yeah, and I know we, in June, we opened our respiratory follow-up clinic. And so I was hoping you could just tell our audience a little bit about that and why we have this clinic.
Sure. I mean, what we know about a couple more differences about between influenza and COVID-19. Influenza can be quite severe, but the course doesn't seem to be terribly prolonged. For patients who have severe COVID-19, they have a very, very prolonged hospitalization. We take care of them for weeks. And so that is quite different. When the patients get discharged, some patients continue to have symptoms, and we don't know exactly why that is, or whether those symptoms are going to ultimately go away, or they're going to be left with some sort of limitation medically, physically from COVID-19. And so we've opened up this respiratory follow-up clinic that's run by our pulmonologists, our lung doctors. And they see patients who continue to have symptoms. The most common symptoms they're seeing are continued fatigue, shortness of breath, maybe even chest discomfort. And they have a protocol that they look at different aspects. They do lung tests, breathing tests, they do x-rays, they do CAT scans. And they are trying to help people to identify how they're going to do, how they can potentially continue to improve at home, and whether there's something else going on. The other thing that they're doing is monitoring what they see. So they have a registry where they're looking at, over the long term, they'll be able to look at how many patients seem to have, short-term but prolonged impacts on their lungs, how many patients ultimately have permanent changes. And so I think it's helpful to the patient in the moment. It's also helpful to us to learn about this virus and what the long-term consequences are. They, if they don't find anything, they then refer those patients to, for example, a heart doctor. If the patient has, breathing troubles or shortness of breath, they may get referred to a kidney doctor, because COVID-19 can certainly impact your kidneys. And if the kidneys haven't come back to normal, then the kidney doctor would be involved. It's a great clinic, and I think we're going to learn a lot from it as well.
Great. I want to circle back to flu season really quick. It's coming up quicker than I think any of us expected for it to. And luckily, many of the precautions we've been taking for COVID-19 might actually help us reduce the spread of influenza a little bit, frequent hand washing and wearing masks. But the idea of living with both of them can feel a little bit overwhelming for people. I'm even a little overwhelmed at the idea. So what are the most important things we all need to remember during the fall and winter season this year?
So I'll start by saying I'm a little overwhelmed too. We don't know what we're going to be facing. I think we have to prepare for the worst of everything. I do take some solace in the fact that, the things that we're doing hopefully should decrease the spread of influenza. I think it's really important that we continue to do those things. And, we talked about earlier how there are outbreaks happening in Iowa, Johnson County, and in other places in the nation. Hopefully those will settle down, and the numbers of people that are getting infected on a daily basis will go down remarkably. We're hoping with all the measures we're doing that happens. And so we'll be back to a low level. And I just want to encourage people to continue to be vigilant as influenza season comes. The other thing that I would say, and it may be a bit challenging for people, is to make sure you get your flu shot. So, over the last several years, the flu vaccine has not been perfect. There's a lot of reasons why that could be, but we feel that it is still very important in stopping the spread of influenza and keeping patients safe from getting influenza. And the challenging part may be that, should you go and get your flu shot, or should you stay home and keep yourself safe? So, I would strongly encourage you to, in a safe way, go to get your flu shot. We're actually working on how we can make that happen so that people can come in, be safe, get it done, and then return home. So continue to follow the 3 W's. and be sure to get your flu shot. And then hopefully, we'll keep our fingers crossed. There'll be a COVID-19 vaccine sometime in the next several months.
Well, your optimism is contagious. I already feel a tiny bit better. Thank you for giving me a little bit of hope and for explaining that and reminding us of those tips.
The other thing I would say that we don't talk about as much as respiratory syncytial virus, or RSV, which happens much more commonly in kids, but also we see it in adults too. And, that happens at the same time. So we are thinking about all of those. Again, same thing. The 3 W's help to decrease the transmission of that.
Great reminder. Christy asks, what is the current advice about flying on a commercial airplane? Is that something we still want to stay away from?
Well, you're in an enclosed space for a period of time. I think social distancing is hard on an airplane. I know that many of the airlines are doing a great job in making sure that they are cleaned and that those disinfecting processes are long lasting. I think also that the fact that they are mandating masks is extremely important and very reassuring. So I would say to you, it's a risk benefit. If you have to fly and you're a low risk person for bad outcomes of COVID, and it seems like the right thing to do, I would take every precaution that you can. Have a small bottle of hand sanitizer with you, wipes so you can wipe off your seat. Shorter flights are better than longer flights. Just follow those safety standards that we talk about when you're not flying. Personally, I would be anxious about flying, but that's not to say that it's forbidden. You just have to weigh the risk and the benefit. They're doing good things, but it's still a risk.
Yeah. So you referenced what the airlines are doing to disinfect and keep people safe. And so I wanted to touch on what our hospital is doing. So for those who haven't been to our hospital recently, could you explain some of the precautions we're doing to keep everyone safe, including our visitor restrictions?
Yeah. So first and foremost, face coverings for everyone. Making sure that we're all wearing face coverings, and in particular when it's a patient situation, whether it's a physician or a nurse or a medical assistant, a resident, pharmacist, double coverage, making sure that we have a medical grade mask and a shield on. We continue to screen all of our employees every day. We all have to attest every day when we come in that we don't have any symptoms of COVID-19. And if we do, we go to employee health and we get tested. So continuing to make sure that we decrease the risk of people having it who are here working, and making sure that they're protecting themselves and others. Lots of signs about social distancing. Our employees are doing a great job of using the stairs and trying to stay out of the elevators. When you go up 7 flights, sometimes they might have to use that elevator. But I'm really proud of our employees that step out of the elevator so that our patients can get in and not have that elevator be crowded. So really about following the safety standards. There's hand hygiene gel everywhere, and we are using it very frequently. And then it's about having as few people on site as is necessary. And so we continue to have people working from home so that they're not in the hallways. We have continued our visitor restrictions. We have lessened our visitor restrictions to be able to have visitors for our inpatients and for those that are undergoing procedures, because those are really hard times. And those hours are limited. And the reason those hours are limited is, just to decrease the potential interactions of people in the hallways and in the clinical areas. So although we don't like it, none of us likes the fact that we're restricting our visitors, because we know that they're very important for the recovery of our patients. We're trying to make sure that we're looking out for everyone. Really important that we protect our patients. Really important that we protect their family members and any visitors they might have. And with COVID-19, an extra parameter that we think about is really important that we protect our employees because they're doing great work, and we need to make sure that they remain safe.
Well, thank you so much for sharing all of your expertise with us here today, Dr. Brennan.
You bet.
And thank you to everyone who tuned in. If you joined us after we started, make sure to go back to the beginning of this broadcast to hear all of the great information Dr. Brennan provided to us. And stay tuned to our social media and our website, uihc.org, for all the latest updates on COVID-19 and tips about how to stay safe. Lastly, remember that things can go back to normal if we all work together by washing our hands often, wearing face coverings, and keeping a safe distance from others when in public, and taking care of our physical and mental health. Thanks for watching.
Thanks so much, and be careful this weekend. Follow those W's.